The journey to starting a family is one of the biggest adventures in life, right? But for a lot of people, that path isn't always a straight line. So today, we're going to talk about what happens when nature needs a little helping hand and how science steps in to offer a whole new way forward.
I mean, you've probably wondered about this. We all kind of grow up thinking it's a super simple process. But honestly, the biology behind it is unbelievably complex. And for many couples, that complexity can throw up some very real challenges.
You can think of it like a journey that has some potential roadblocks along the way. And it's super important to remember these aren't anyone's fault. They're just biological hurdles that could make getting from point A to point B a little tougher. So, what are some of the most common ones? Well, for starters, things like blocked fallopian tubes can literally create a physical barrier. Then you have ovulation disorders, like polycystic ovary syndrome, you probably know it as PCOS, which can make everything unpredictable. Other times, the challenge might be with sperm health or with egg quality, which, naturally changes as we get older. And for some, it's about conditions like endometriosis or even the risk of passing on a genetic disorder.
It's a pretty powerful thought, isn't it? What if there was a way to just drive right around those challenges? This is exactly where modern medicine and all this amazing reproductive technology comes into play, offering a totally different road on the journey to parenthood. And that leads us straight to in vitro fertilization, or IVF. Okay, let's dive into this. At its heart, IVF is a scientific process that's specifically designed to tackle those very roadblocks we were just talking about. By moving the whole fertilization part into a super-controlled lab environment, it opens up solutions that just aren't possible otherwise. So how does it really work in practice? Let's get into the specifics, challenge by challenge. We're going to look at some of those hurdles we mentioned and see exactly how IVF offers a custom-built solution for each one. Okay, first up, blocked fallopian tubes. So in a natural cycle, the fallopian tube is basically the meeting spot for the egg and sperm. If it's blocked, they just can't get to each other. Simple as that. IVF's solution is, well, pretty genius. It just makes that meeting happen in a lab dish instead. The tubes are completely taken out of the equation. Problem solved. And what about something like unpredictable ovulation, which is really common with PCOS? Trying to conceive naturally can feel like a total guessing game. With IVF, doctors can use medications to stimulate the ovaries, encouraging them to produce several mature eggs all in one go. This gives everyone so much more control and way more opportunities to work with in a single cycle. Now, fertility is a team sport, and it's not just about the female factor. If there are issues with sperm count or their ability to swim, that's called motility, it can be really hard for one to reach the egg. In the IVF lab, the experts can actually handpick the healthiest, strongest sperm from a sample to give it the absolute best shot, and sometimes they get even more precise. It's a technique called ICSI, and seriously, the technology here is just mind-blowing. With ICSI, a scientist selects one single healthy sperm and using a tiny needle injects it directly into the egg. It's like giving that one sperm a VIP pass straight to the front of the line, totally overcoming big hurdles like low numbers or poor movement. But the power of IVF doesn't stop at just getting the egg and sperm together. It also offers this incredible chance to get vital information before pregnancy even starts, especially when it comes to genetics. This happens through something called pre-implantation genetic testing, or PGT. It's basically a screening test for the embryos that are created in the lab. It checks them for specific genetic or chromosomal issues before one is chosen to be transferred. The whole idea is to boost the chances of a healthy pregnancy and, ultimately, a healthy baby. And honestly, the impact this can have is nothing short of life-changing. For couples who know they carry genes for serious diseases, like cystic fibrosis or Huntington's, PGT gives them a way to ensure they don't pass those conditions on. It's an absolutely incredible tool for building a healthy family with real peace of mind. So the crucial point here is empowerment. For families who have a history with these conditions, IVF with PGT gives them a level of control that was just unimaginable a generation ago. It completely changes their journey from one filled with uncertainty to one of proactive choice. Okay, so we've covered the why behind IVF, but what does the journey actually look like? I know from the outside it can seem really complex, but it actually breaks down into a few main stages. Let's walk through them really quick. So here it is, step by step. It all kicks off with ovarian stimulation, using those medications we talked about to grow multiple eggs. Then comes the egg retrieval, which is a quick and minor procedure to collect them.
After that, the real magic happens in the lab during fertilization and embryo development. And finally, the whole journey leads up to the embryo transfer, where the best embryo is gently placed back in the uterus, hopefully ready to snuggle in and grow. So we've looked at the hurdles, the solutions, and the process itself. But what does this all mean for you or for anyone out there just weighing their options? Let's tie it all together. I think this really says it all. IVF isn't about replacing nature. It's about offering a controlled, scientific alternative when those natural barriers are in the way. It's all about opening doors and creating new possibilities where it might have felt like they were closed. If you only remember one thing from our whole chat today, what should it be? When you look at all these different challenges and all these amazing solutions, there's one idea that just keeps popping up. It's this. IVF empowers you. It gives you so much information about your own fertility, and it hands you back a measure of control over a process that can so often feel totally out of your hands. It's a proactive path forward, one that's filled with hope and driven by some truly incredible science. Now, it's really important to remember that this entire discussion is for educational purposes only and is not a substitute for professional medical advice. For any medical questions, please consult a doctor. For more information about the complete IVF process, you can visit the portal shown on the screen, ivfforme.com. Thanks so much for hanging out with me.